for sexual intimacy, being able to talk openly about your partner and make it fun. You don't have to get gross. You don't have to like, inquire about every bowel habit and everything else.
Mhm.
But like, if you can't talk about the same parts that you want to play with, you don't have an intimate relationship. So get
Mhm.
comfortable with it. Just be like, hey, I want that stuff to work as best as possible for my own self gratification and for
Mhm.
yours,
Mhm.
right?
Welcome to the Owning Your Sexual Self podcast. I'm your host, Rachel Main, sex and relationship coach and therapist, and I'm so honored to have you here. This podcast was created as a space for honest, nuanced, shame-free conversations about sex, intimacy, desire, relationships, and what it really means to feel at home in your body. Whether we're talking about pleasure, boundaries, communication, healing, or the messy middle of long-term relationships, this is a place where you don't have to have it all figured out in order to belong. As I enter into my 6th year of podcasting, I feel more committed than ever to helping you soften the pressure, trust your body, and build a relationship with your sexuality that feels grounded, empowered, and true to you. So take a breath, let yourself arrive, and know that wherever you're starting from is more than enough. Now, let's get into today's episode. All right. Hello, everyone. Thank you for so much for listening. Continuing to listen to the show. I have Dr. Jordan Barber on with us today, and we're talking pelvic pain, the things that we probably need to know that we might not know. And we're going to focus specifically on men's pelvic floor, a little bit for women, but as I mentioned to you, Dr. Barber, like we get a lot of talk, but for the women here. So really excited to get more in the men's perspective with you. So thanks so much for coming on to the show today.
Super excited to be here and really glad to raise awareness for men as well, because they're in medicine, it's the only place that men are kind of really just not focused on.
Yeah.
Um, so hopefully maybe raise some awareness and for the women listening, hopefully with their partners to maybe identify things that they're not even aware of.
Yeah, hey, have you considered this or tell me more about this? I'm curious, yeah, just if you could share a little bit about your background, why you became so passionate in treating pelvic pain specifically.
So typically when you think of pelvic pain, you're either going to think of physical therapist, which is, kind of the standard, and I work with them hand in hand, or urologist, gynecologist, or pain specialist. I'm none of those. I am out of left field. I have a doctorate in acupuncture and oriental medicine, and my doctoral focus was pain and what's called psychosocial phenomena, which is a big fancy word, which is an easy way to kind of explain how Chinese medicine looks at stuff in a westernized view. Um, I treat orthopedics. That was always been my bread and butter. And I started noticing that people have strange things and I didn't even know what to do. I was like, well, what is that?
Mhm.
And what I also realized is how much it was affecting their lives, right? Because, your back hurts. Yeah, that can impede your life. Your shoulder hurts, impede your life. But we also have a really good care in the States for back and shoulder pain. It could be tricky, but, it's decent. But when you have weird testicular pain, right? And a doctor gives you medication or says it's prostatitis,
Mhm.
um, or you have painful insertion or pain after orgasm. No one knows what to do with it. And urology is like, oh, you seem fine, no big deal.
Mhm.
And so they come to me because you wind up with an acupuncturist. And my subspecialty is really dry needling. So it's a very biomechanical way of treating things. But you wind up with people like me, acupuncturists, when you got no other choice and you don't know what to do, which always makes things hard because, that means you have the complex case. And I realized, this is something that like really piqued my interest, and you had a large impact on people's lives
Mhm.
because this affects their relationships, affects how they could work, their self-esteem, their intimacy.
Mhm.
Where, shoulder pain, you could disassociate enough from it. Ibuprofen works.
Mhm.
Um, so that's kind of my perspective of where I come from. And from that, it gives me a very integrative perspective. Because while I still treat the same structures and I'm very biomechanically driven and evidence-based driven, um, I see things through a different trained lens that standard of care would have it. And pelvic PTs, I wouldn't really call standard care. Those are, the unsung heroes of physical therapy,
Mhm.
but they're still coming from a physical therapy lens. So it's another set of eyes to see how the body might be
Mhm.
functioning.
Mhm. Yeah. And so as you're speaking, like this sounds like this is something that is just very widely underdiagnosed in the US and probably across other countries. But as you're saying, a lot of people, when they're maybe noticing some things, it's first off, it takes a lot of courage to even address those things with a doctor and then to get dismissed right afterwards, as you're just noted, like all of those emotional effects, those psychological effects that could take place on a person. And yeah, it's just it's sad. And I have a lot of people on the show, like I mentioned, like pelvic floor PTs and acupuncturists and people that are just very niched in their field. And it just saddens me so much because it feels like it's such a shame that the population, the general population, isn't aware of things like this that are available to them, or they're not easily acceptable. I feel like in a lot of cases, for somebody to be like, to even think I'm going to try acupuncture for this thing.
Well, you said the operative word, shame,
Hmm.
especially with men. So, for females, 60% roughly will experience pelvic floor dysfunction
Hmm.
throughout their life.
Hmm.
Where men, it's about 12%, which is not a small percentage. But, you know, men don't even know what it means. Half of them can't even find their pelvic floor. They're like, what's that?
Or
And
know that
for
they have a pelvic floor.
right, and
Yeah.
and for females, it typically, happens near and around childbirth. So it's identifiable. We had something happen down there. There's a safety net. People know how to talk about it. So there's at least some awareness. Some. There needs to be more.
Mhm.
But for males, it shows where they have urinary difficulty, pain after ejaculation, erectile dysfunction, could be pelvic floor dysfunction,
Mhm.
tied in with emotional health, psychosexual views of ourselves.
Mhm.
There's so many things that are involved. So yeah, it's it's a confounding problem, I think.
Mhm. Mhm. Yeah. And then yeah, coming back to that shame word, men, I
Mhm.
think like this area of the body, right? Like that's attached so deeply to their masculinity, their power, their manhood essentially. And so again, like that courage that it takes to speak up with this, to share it, whether that be with a doctor or even share it with a partner, like, hey, I got this going on. Like I don't really know what to do. I can just imagine like that's a lot of fear that they're holding inside themselves.
What I've realized is I've had, men, especially young men. This affects a lot of men really through any age, surprisingly, where
Mhm.
they'll wind up on like my clinic site. They're actually looking for some back pain or some like weird hip pain they have from working out. But then they see some stuff like, oh, pain after ejaculation or orgasmic issues or whatever. And when I'm talking to them, like, I noticed on your site, it says this. Could that be related? Because then they're starting to make the connection because they're
Mhm.
seeing like similar subject matter.
Yeah.
As far as shame, you know, women, uh, they go to gynecologists. They're used to at least talking about certain things. Men don't go anywhere related to that. And
Mhm.
we run from the urologist. We're not interested because it needs a digital rectal exam. So it's like, I'm only going there if I really have to. So
Mhm.
you wind up at a GP who's not trained in pelvic health, your regular family care doctor. And it's like, oh, it might be prostatitis or you may have a UTI, right?
Mhm.
And the amount of men that suffer from pelvic pain, urinary urgency, and stuff like that, but have a negative urine culture is
Mhm.
substantial.
Mhm.
Yeah.
Yeah. Why do you think that this is so like rarely talked about?
I had a conversation with a patient about that recently because this is something I think about why, you know, just thinking from a female perspective, the body is designed in a certain way to function and should function fairly healthy. So why do we have so much stress incontinence after childbirth? That
Mhm.
shouldn't really happen. That should be like an oddity, but it's extremely prevalent. So when I start thinking about why does it happen, it's how we integrate into our society in a modern way. We sit a lot. We don't have strong core strength. We don't move a lot and move in dynamic ways, which allows us to stretch our fascia to really have mobility and pliability. So when we injure ourselves or when we just tighten in a chair, that tension starts affecting the pelvic floor and creates all these weird anomalies.
Mhm.
For men, also, they work out, they ride bikes, they love to do their deadlifts and everything else, or they play soccer. And that little hamstring strain that didn't get treated properly starts webbing and affecting the pelvic floor.
Mhm.
And it will feel like pain. So they don't realize that, oh, this is something that's maybe from that hamstring that's now affecting, the pelvic floor complex and is pushing on some of the nerves that's affecting ejaculation or blood flow to the ability to fill the penis so that it can stay erect. And instead, they take Viagra, Cialis, which may help, but not realizing that it's a blood flow or a fascial or neurological issue.
Mm-hmm. Yeah, yeah, I know the doctors are generally real quick to be just prescribing those things, and yeah, it's to me it's the Band-Aid fix, the easy fix, and likely I think yeah, I'm with you. It's the body is like trying to tell you like, hey, there's something to look at here, like there's something that we could do better here.
No, I agree. And, raising that awareness that it's okay to talk about your body
Mm-hmm.
because you have to be in your body. And we kind of disassociate from a pelvis as a society, right? We're ashamed of things that happen there, except for when we want to have sex. And even then, there's a lot of shame that comes with how we have sex, how we connect, or we disassociate during it. It's very weird what can happen because of how our society's structured, as well as trauma and everything else. So to be able to say, it's weird. Like men, when we're at the bar, we don't talk about, last night I had an orgasm and it hurt for 3 hours.
Yeah.
I would look at my friend, prior to my knowledge of pelvic floor, and be like, what's wrong with you? Why are you talking about that? Right?
Mm-hmm. Mm-hmm.
You should see a doctor. But then you go to the doctor and he looks at you like, you get your prostate checked. You
Mm-hmm.
know, like
Mm-hmm.
it's an infinite circle of poor care.
Yeah.
And there's so many options out there. And so what I do is dry needling, which is using needles that are acupuncture needles, but we're inserting them in specific ways to make muscles soften or to change the way nerves fire or entrapment of nerves,
Mm-hmm.
which changes signaling and everything else down there. Um, and it's a technique that's not very popular right now for pelvic floor work. And I work with tons of PTs. Most of my patients are referrals from PTs.
Mm-hmm.
When pelvic care stalls, right? Because sometimes you hit plateaus, when they want a different set of eyes, or you just want to accelerate the speed of the repair or getting rid of whatever issue you have, because it's not always repairing something.
Mm-hmm.
Um, and, it's something that I'd love people to look for because it is something that's starting to get popularity to say, in addition to PT, PT is the gold standard.
Mm-hmm.
If you're not getting PT, you need to start.
Mm-hmm.
But then if you're hitting plateaus or you need neuromodulation or other things like that, people who are more, focused on these unique skill sets in pelvic health are out there. And there's becoming more and more of us. Not many, but we're growing. And
Mm-hmm.
it's a piece of the puzzle, and we're not always the answer. But there's times where sometimes I just see things, I release the things I need to after 2, 3 sessions, and I dialogue with PT, but then they're good, and that to me is perfectly fine.
Yeah.
It's how do we get people back to whatever normalcy they're seeking? Because what
Mhm.
is normal? I have no clue.
Yeah. Yeah. And do we really want normal? Or do we want optimal? That's another conversation that happens often around here.
Yeah, well, I want to know who's defining normal before I say I want it,
Hmm. Hmm.
right?
Yeah.
In the pelvis, I want it to function. That's all I'm looking for. And then you drive it how you want,
Yeah.
as long as it does what you want, no problem.
Hmm. Hmm. All right, y'all. I'm here with another recommendation. So sorry to interrupt your podcast, but I have to talk about the Foria products that one of my colleague Susan Bratton, she sent me these last year, and these have been a game changer in the bedroom for us. Like, I cannot stress enough. So, I need to go over some of these things with you. So, first off, the Awaken Arousal Oil. Literally imagine the best orgasm and sex that you've ever had. And now imagine that could be even better. And that's exactly what these products are designed to do. They naturally enhance sexual pleasure and give you access to bigger and better orgasms. Yes. And like I'm attesting to that right now. And what an arousal oil is, and awaken, this is their words. Awaken is like a juicy warm up that helps you get really turned on, increasing your pleasure, deepening your orgasm, increasing your connection with your partner. Awaken uses CBD and warming sensation inducing organic botanicals that enhance arousal, sensitivity, access to orgasm, and overall pleasure. And best of all, Awaken just turns you on. Yes, you lady that is listening. And Foria Awaken is a proven product that actually works. 92% report feeling more aroused, and 92% reported reaching orgasm. So there is a pleasure set that they offer. This is what I would recommend to go with because you get to try each of their best sellers. So in addition to the Awaken Arousal Oil, you get within the pleasure set, it comes with all three of their best-selling intimacy products: Awaken Arousal Oil, the Sex Oil, and the Intimacy Melts. So Awaken stimulates her arousal and increases sensation. The Intimacy Melts helps her experience deep internal waves of pleasure. And the Sex Oil lubricates during sex and creates a juicy experience for the both of you. Literally, the magic combination of all three of these is the ultimate sexual experiences that will take your connection with your partner to the next level. These have been so, so, so good. So fun. Danny and I, when we're together, he's like, do you want me to grab the sex oil? And I say, is that even a question? Hell yes, let's do it. So if you want to check out these products, you can go to their website, foria.com. It's foria.com. And if you use the code MAIN20, it's going to take 20% off of your order. I gave it the wrong website. I'm so sorry. It's Foria Wellness, Foria wellness.com. And same code, MAIN20 is going to take your 20% off. And then on top of that, they're always running deals for like free shipping and things like that. So check it out. Let me know what you think. And I'm telling you, have I ever steered you wrong? Like these are so freaking good. Enjoy. So yeah, you were just explaining a little bit about dry needling and how it works. And so what does, I'm assuming people are gonna have questions, like what does a session feel like? Is it painful? How long does something like this take? And who exactly is this appropriate for?
So it's more appropriate for hypertonic conditions or fascial entrapment conditions. So those are going to be usually the younger population. Those are suffering from tightness disorders. That's what hypertonic is. Those that have hypotonic pelvic floors, which is more prolapse, which typically comes with more aged populations, but you could have hypertonic in aging populations. It's less adapted for because we're really adept at softening things. But the neuromodulation, everything else can still help them. But I'm not hitting it out of the park at that point with those patients. And I'm very clear about explaining, what we can and can't do. Does it hurt? Dry needling has a flavor to it, shall we say. Typically you get a localized twitch response. It's like an eye twitch. Eye
Mhm.
twitches don't hurt, but if your adductor, the inside of your thigh twitches, it's a very large muscle. You're going to yelp, but not out of pain. But it's
Mhm.
just like, whoa, what just happened? And then usually we laugh because it's fun.
Mhm.
Or you get a dull ache, which is like that hurts so good sensation you might get during a massage, but
Mhm.
there's no pressure with it because no one's massaging you. So that's a little weird sometimes. And that may radiate and even reproduce the pain you have, which is super ideal because it's also going to start to retreat, which means now we're able to start immediately attacking the areas. The results are fairly quick. Within 1 to 2 sessions, you start seeing things. And I tell my patients by the fourth to sixth session, if there is zero change, we're not getting change by the 10th,
Mhm.
right? Because it's literally changing the muscles and it's literally opening space for the nerves. So if we do that and you don't have change, well, it's somewhere else. Or
Mhm.
there's something we haven't figured out, and it could be stress induced. It could be a bunch of different things. And I think the other thing to raise awareness is that so many of my pelvic floor patients, when it's not directly related to childbirth or some sort of trauma that just occurred, car accident or other thing like that,
Mhm.
there's a mental condition to it, stress or otherwise. And if they didn't have it, like maybe it was purely musculoskeletal, but now that they've been dealing with urinary urgency and leaking, it's become
Mhm.
a stress related issue.
Mhm.
And now that it exists, you want to think it's going to go away, but the hypervigilance of these issues starts creating these anxiety or sympathetic locks where the body's stuck in this fight or flight. And now there's a mental health aspect that we have to address it. clinically, I use a lot of vagus nerve stimulation techniques and other things, or I talk to patients who are using vagus nerve to help them get into a parasympathetic or rest and digest state.
Mhm.
And if I notice there's deeper, trauma or deeper issues going on, and we talk about mental health and counseling and other things like that. But usually when it's just they're stuck in a cycle secondary to the issue, I find vagus nerve stimulation is incredible because we just got to get them out of it. And then once you realize things are better, well, then you give up. You're like, oh, I'm not worried about it. But you have to get the brain to give up for a
Mhm.
bit and the nervous system to release. I had a patient recently say that when they went on a meditation retreat, they had none of their pelvic health conditions. And I just stared at them. I was like, well, there's your answer.
Yeah.
I'm like, I can help you. But then I was like, let me talk about vagus stimulation. And I think you need to meditate more.
Mhm.
I mean, the answer is right there, but sometimes we just don't realize it because, something that's bothering you becomes very front and center.
Mhm.
And you
Mhm.
don't realize, oh, this was gone. Why? Oh, stress.
Mhm. Yeah. Yeah. People, yeah, don't underestimate the effects that stress have on our body. And as you're speaking to, it's like if you're noticing something, there's really are the risks for it to become worse long term and lead to, yeah, more serious things, mental health included. That makes a lot of sense.
Well,
How?
one of the things I tell the patients is, during treatment is to become more aware and
Mhm.
write down things. Where do you feel pain? How did, like, let's say we got rid of the pain and then started coming back. How did it come back? What were you doing then? What was your sleep like prior? Because we need to rule out, is it musculoskeletal? Is it stemming from something else? Was it that you were sitting at your desk for 8 hours? Was it,
Mhm.
something else? Because sometimes we miss those nuances in care. So that awareness and being empowered to become aware, even if you're using pelvic wands and everything else, of paying attention to it as opposed to applying a prescriptive exercise or even a stretch, paying attention to that stretch. Awareness and awareness of the pelvis itself really gives really good clinical pearls that both pelvic floor therapists and people like myself can start using to start integrating the person as a whole being again and
Mhm.
making them alive in their pelvis.
Mhm. Yeah. So, dry needling, is it the same as acupuncture or it's different than acupuncture?
So that's an argument that it's forever. It is a subset of acupuncture.
Okay. Okay.
In acupuncture, everyone knows about the meridians or the channels, right? We think about acupuncture channels. There's a secondary series of channels, sort of called the sinew channels or the jingqin in Chinese, which is really analogous to the fascial lines and fascial planes in the body.
Mhm.
So there's always been techniques because it was very obvious. If you hurt your shoulder and it was stuck there, it wasn't an internal medicine issue. There was something wrong with the shoulder, and you got rid of the knots and you made it move again.
Mhm.
From that, from like the 50s and then into the 70s, medical doctors that were very respectful of acupuncture started pioneering this work and saying what's going on, and started with trigger point therapy, which are kind of these tender spots that acupuncture's identified. And they started saying, well, what is happening physiologically here? From that, you had this small divergence of people just being very focused on treating those trigger points,
Mhm.
and it became very biomechanical.
Mhm.
For me, my roots are always in acupuncture, and my published work is on this intersection between that classics and the biomechanical world. I don't really see a difference. I'm much more interested in patient outcomes.
Mhm.
The term dry needling versus acupuncture is a territorial war
Mhm.
between different states and what practitioners are allowed to do it. I think if you're competent and you're dedicated to your patients, I don't see an issue,
Mhm.
right? That licensure stuff and everything else. In states, there's PTs that can do dry needling.
Mhm.
And as long as they have the appropriate training and they're aware of safety, I don't see an issue with it.
Yeah.
States like where I am in New York, the only people that can do it are acupuncturists, which is
Yeah.
fine by me, but I don't really, there's enough people out there that need help. I just care about competency
Mhm.
because, there's injuries that can come along with it, not so much in the pelvis, but the diaphragm itself is part of the pelvis, right? So when we breathe, there's an interrelationship. I'm sure other people spoke about that. You can puncture a lung and dry needling is more aggressive. And recently, there was a major football player who had, got pulled out of his season because he had a deflated lungs.
Mm.
I won't go into it any further, but it wasn't an acupuncturist that did it.
Mhm.
So I would just look at competency, but dry needling is ultimately just a subset of it that is focused on biomechanics. It's
Yeah.
acupuncture needles doing acupuncture.
Okay.
And we're just not thinking of balancing your meridians,
Yeah.
but that's happening anyway. So, you know,
Thank you. Yeah, thank you for the
yeah.
clarification. I was just, yeah, trying thinking through like, okay, if somebody's listening to this, what are they asking? And hearing about this, like being new to it myself, I'm like, okay, let me allow this curiosity lens to come through. And I want to reverse back a little bit. Earlier in the show, you mentioned that you really want to help partners understand if their male partners experiencing pelvic pain. So what is some advice that, given our show is mostly female listeners, what would you have for them?
Well, so men are particularly thick-headed, and will only start asking for help when it's too much. And too much is a little too late, right? Especially nerve compression, everything else. Then, you have atrophy and all these other things that come. So the people that have been the best advocates for men are women. So it's usually their partners,
Hmm.
in heterosexual relationships, but partners are the best advocates for men because even, in gay relationships, it's the partner. It's like, you keep complaining, you need
Hmm.
help, right?
Hmm.
So being able to identify the signs is, if they're urinating more, right, or having poor bladder voiding or they're leaking, you're doing their wash and you notice there's a little more urine on their underwear. Very weird, but if you're married, you know about these things, right? You can raise it if you notice their sexual performance isn't that good these days. It could be stress. If you notice that they are, say there's any sort of weird pain, if you notice it's related to when they work out, things
Hmm.
like that, to just, or if they went to the urologist and went to the doctor because they said, oh, I don't know, I'm having some urine issues. I think I have a UTI, but there's nothing there. If there's nothing there, it's not bacteria. And
Hmm.
that's the first warning sign, and it's only going to get worse.
Hmm.
So things like that. And, you know, for sexual intimacy, being able to talk openly about your partner and make it fun. You don't have to get gross. You don't have to like, inquire about every bowel habit and everything else.
Hmm.
But like, if you can't talk about the same parts that you want to play with, you don't have an intimate relationship. So get
Hmm.
comfortable with it. Just be like, hey, I want that stuff to work as best as possible for my own self-gratification and for
Hmm.
yours,
Hmm.
right? And I think being able to be comfortable with our bodies, right? We can't just ignore this thing that's covered by underwear. That's like, our like Adam and Eve leaf, right? That's
Yeah.
it's foolish, right?
Yeah.
Especially in the word intimacy. If you want to be intimate with someone, you have to accept everything.
Hmm. Yeah.
So I would say for partners to, inquire and be like, I want you to be the best you are and the happiest you are. And I noticed some weird things. Let's talk about it.
Hmm.
You know,
So will you be taking up your next certification in sex therapy then after all of that little spiel you just
absolutely
had?
not. I realize I'm only good at certain things and I love talking to my patients and I love referring.
Yeah,
So,
fair.
but I will raise awareness all day.
Yeah. Well, we, as being on that side of it, we are always very appreciative when other practitioners are not afraid to have the sex conversation with people and yeah, and bring up those sexuality related things with them because yeah, so often they're ashamed or they do get the I don't know, like I'm not the person or so
Yeah.
thank you for that, for having that scope in your practice.
We can't heal the pelvis if we can't talk about it.
Hmm. Yeah,
Bottom line.
agree. So someone's listening to this, let's say they've been silently suffering or they're listening to this like, oh shit, that's me. That might be me or that might be my partner. Where do you recommend that they start first?
So I'm the worst promoter. Don't start with someone like me because we're a procedure,
Yeah.
right? We really are a procedure. We'll probably be able to help you if you came to me first line, but I'm referring you out too, right?
Hmm.
Um, I actually, depending on your state, if you have direct access to PT, sometimes you need a referral.
Hmm.
Start with pelvic floor PT because they do evaluations, right?
Hmm.
Um, you can go to your GP for urological evaluation. Always be safe than sorry, but PTs are well trained for the red flags, and they're going
Hmm.
to probably send you out to a urologist if there's an issue. And, if they want to continue to care, especially under insurance, they usually eventually the insurance companies want an MD to sign off anyway.
Hmm.
So they have good networks, and they also have pelvic aware networks, medical
Mhm.
doctors that get it,
Yeah.
right? So I think the best place to start is with pelvic floor PT,
Mhm.
and then people like me are part of those networks.
Mhm.
In New York City, I have been so welcomed and accepted by the pelvic floor community that blows my mind. It's a level of acceptance I never had as an integrative practitioner.
Mhm. Mhm.
And that just shows the passion of the pelvic health community, that
Yeah.
they just literally care about their patients. And it's a lovely world. I hope no one has to enter that world, but if you're there, you're in a great world. So you start with them and they will guide you,
Mhm.
you know?
Yeah. Yeah, I have to say same. All the pelvic floor PTs I've had on the show are just they're just a special type of person. Like they just have that passion and that advocacy behind them, and it's I love that.
It empowers me and it keeps me like so alive. I mean, I get emails back and forth about shared patients with like jokes about, the city or the subways and everything. Like it's just become like a big family
Hmm.
and I love it. It's how medicine should be.
Hmm.
Um,
I agree.
and I hope that happens in the rest of medicine, but sadly
Yeah.
not.
Sadly, we're here. Um,
Yes.
I also want to follow up and ask, like, when they are going to their providers, what are the questions that they should be asking that allows them to advocate for themselves?
Ooh, you know, so if you're going to a pelvic floor specialist, they're going to ask you the questions. You just tell them
Mhm.
what you're experiencing.
Mhm.
But if you're at a GP trying to get that referral, start asking, hey, I think it could be muscular. The urological culture was negative. I don't have any bacteria. You put me on an antibiotic, maybe responded for a second. This is not going away. And I've read a lot about this because please go read because you
Mhm.
have to be informed and you have to be an advocate. And if you're a pelvic health patient, every single one of the people by the time they get to me, they've had pelvic floor therapy. They know the pelvic floor. I could talk to them like a doctor
Mhm.
because they're like, oh, I've been reading about obturator internus and the entrapment of pudendal nerve. And I'm like, and you're a CPA? Okay, cool. But it's like, because they're so invested in getting better. So
Mhm.
you have to self-educate, but you need to start asking the questions that the medical doctors aren't going to ask. Hey, I think this is muscle. I would like a pelvic floor evaluation. Can you please refer me?
Yeah.
Right? Demand for the evaluation. Once you're with the pelvic floor therapist, they got you.
Mhm.
Right? They're going to help. And just don't be afraid. One of my favorite pelvic floor PTs that I share patients with on her bio, it says there's no such thing as TMI.
Mhm.
And just remember that goes for every pelvic floor therapist. We've
Mhm.
heard it all. We've seen things that, yeah, we've heard it all.
Mhm.
Where you're just like, okay, we don't have a judgment lens. We're just like, cool. All right, how do we figure that out? Or that sounds exciting, right? Like it's fine, whatever it is.
Yeah.
Um, so don't be ashamed
Mhm.
because trust me, we've seen it all, we've heard it all, and you're probably not the worst.
Mhm. Mhm. Yeah. Well, thank you, yeah, so much for this conversation today. I really love the information that you're bringing to the show and just giving people another lens of thinking about this, another option to possibly look into if that's going to fit in their wheelhouse. I'd love to end with a little rapid fire myth busting with you if you're open for it.
Ooh, let's see if I'm ready for it. Let's go.
Yeah, it's like he said, everyone, before we hit record, that I could throw anything at him.
I love it. Let's see what happens.
All right. First one is pain with sex is normal after childbirth or with age. Is that myth
There's
or true?
no, sex is supposed to be enjoyable.
Yes.
So no, it's not normal at all. And if you notice it, don't think it's going to go away. It's not. And if it goes away, there's still something hiding and
Mhm.
it's going to rear itself in some other way, or you're going to start noticing other dysfunctions,
Mhm.
easily treated, especially in its acute stage.
Mhm. Mhm. Okay. If your tests are normal, the pain is just in your head.
No, no, that's silly. Although, how big is your head? What is the head, right? Your body and your mind are not separate, right? This the dualistic view. No, you're not separate from yourself. So the nervous system is always integrated, but don't just think it's a psychic condition. It's
Mhm.
absolutely foolish. No.
Mhm. Yeah. And then last one, pelvic pain will generally lead to some type of surgery.
No, no. I mean, sometimes there's surgery, but we try to avoid it, right? And
Mhm.
that's more after significant, like accident level trauma.
Mhm.
Sure.
Mhm.
Endometriosis, right? Can lead to scar tissue, creates pelvic pain. So there's times that it is, but pelvic pain can be cured,
Mhm.
or it can at least be well managed with proper care, sometimes nerve blocks and things like that. It really depends what's going on and how severe the condition is. But surgery, honestly, there's not many surgeries that fix pelvic pain.
Mhm. Yeah. Yeah. Which I think is helpful for people to know because it makes it so much less scary.
There's nothing scary about pelvic floor therapy except maybe a little embarrassment at first if you're not the most sexually open person.
Hmm. Hmm. Yeah. And if we could maybe end on like a happy note here, what outcomes have you seen in your practice that have really given you the most hope in this work?
I've seen miracles that I couldn't even understand,
Hmm.
like single treatments where, they went from stress incontinence for 4 months post childbirth to running a 5K with zero leakage. And I was like, so what did I do exactly? But it's sometimes it's just if you get the clinical picture right and you release the muscles and enough that the pelvis just responds, it can be miraculous,
Hmm.
But I also say it doesn't always happen, but I've seen also slow and steady wins that are
Hmm.
just as endearing. I now mark on my kind of like a calendar my wins because sometimes we focus when we don't win, right? And we start thinking we're not succeeding. And I've realized there's a lot of great outcomes that sometimes I don't notice because they're slow and steady.
Hmm.
And that is super like rewarding, but also something you have to remind your patients. And I needed to remind myself to say, hey, look, you are improving.
Hmm.
You had X and now you have Y. It just took a month and a half, but we're almost done. You
Hmm.
know, um, so I think there's so much hope out there,
Yeah.
you know.
Hmm. Hmm. Thank you so much. Yeah. And yeah, I know you're in New York, but if people are listening and they're in the area, how can they find you? Or is there like a listserv of some sort where they can find people that specialize in this?
Yeah, so there's two referral networks as far as people trained. There's ASE directory.com. Those are usually people more with my background.
Mhm.
And there's a pelvic health thing. And there's the Myo Pain Seminars that has a pelvic health course as well. And those are usually PTs that do dry needling. Depending on your state, you'll find people, those are pretty good. I have R Pelvic Dry Needle, which is a subreddit that I recently created. And on the wiki, you'll find those links. And there's tons of research on this stuff to kind of educate yourself.
Mhm.
Otherwise, I'm on the Upper West Side in New York City.
Mhm.
It's a boutique clinic. And you could find me on practically any social media. I'm more focused on some than others. I don't like social, but it's a necessary thing. And it's J Barber, LAC. LAC stands for licensed acupuncturist. And, but I'm very Googleable.
Very cool. I like
Very
that.
Googleable. Yeah. Hard to say, but
Well, thank you so much again today, Dr. Barber, for coming on to the show. It was really a pleasure to have you, and we'll make sure to link all of that in the show notes for people so they can find you easier or find other people in your profession easily.
I really appreciate your giving me access to really raise awareness.
Yeah,
Thanks so much.
for sure. We need more. We need more of you. We need more options for people. So thank you again. Thank you so much for spending your time with me today on the Owning Your Sexual Self podcast. If today's episode resonated with you, I invite you to pause and notice what stood out, what stirred something in you, or what you might want to explore a little bit more gently this week. If you'd like to support the podcast as it continues into its 6th year, subscribing, leaving a review, or sharing this episode with someone that you trust and love truly, truly means the world to me. It helps these conversations reach more people who need permission to feel less alone in their sexuality and their relationships. You can find more resources, programs, and ways to work with me in the show notes, and I'd love to connect with you beyond the podcast. Until next time, keep honoring your body, your boundaries, and your becoming. I'll see you soon.